Today I have Gugu with me, who has done chemotherapy, and she combined it with ozone therapy, and she's gonna explain to us. We're gonna talk about what she experienced, because you had basically two different series of chemotherapy, one in 2018 and now the other one 2020. And one time you combined it with ozone therapy this year, but before you did not. And you told me that you had two completely different experiences, right?
That's correct, yes. Yes.
All right, so let's get into this. So tell us first what the chemotherapy was administered for, like what was your diagnosis, how you were diagnosed, and what exactly you did.
Okay, so 2018, I was diagnosed with stage 3 ovarian cancer. I had a hysterectomy, complete hysterectomy, where everything was completely removed. And then 6 weeks later, I started on chemotherapy for 6 months. And then after completing the 6 months, I did another 3 months of bevacizumab. Please excuse my pronunciation of some of these medicines. They're very difficult for me to remember the correct pronunciation. It was basically 3 months of another type of drug that blocks the cancer growth. But my experience of that, and I've always considered that possibly because I'd had surgery, and then chemotherapy immediately after, that my experience was quite not as should I say pleasant as the second one, where I used ozone. So the first session in 2018, I did not use any ozone whatsoever. I was always tired. I didn't look as well. I did look sick. Whereas in 2020, when I was re-diagnosed, I used ozone along with the chemo. So I used ozone on a regular basis. I used the rectal application, and I also did breathing, and I also did it in the sauna as well. So I pretty much did that on a daily basis, and I really honestly felt like myself. There was not much difference in terms of being on chemo and not being on chemo. I was able to do everything that I was able to do I didn't look like a chemo patient aside from losing my hair, but I honestly did not look like a chemo patient.
Mm-hmm. You told me when we talked before, you told me that in 2018, you were barely able to fold your laundry. And when you did that, you were like done for the day. It was, you did so much fatigue.
Yeah. The fatigue was overwhelming. Just like folding, like I said before, folding a basket of laundry was just exhausting for me. So that was pretty much, I just did, yeah. And like when you have that level of fatigue, it contributes to depression and, just your mental well-being as well.
Mm-hmm. And okay, another interesting thing that you told me is that now in 2020, when the cancer came back, that you first tried only ozone therapy in the hopes that maybe this would be enough and that you would not have to do chemotherapy, but this was not so, correct?
That's correct, yes. So when I was first diagnosed this year, my doctor was like, you need to start your chemo right away. And I was adamant that I was going to do it the natural way because I didn't want to go through what I'd gone through before. And I said, can you just give me some time? So I just had a scan, and it showed tumors on my liver and my peritoneum membrane, and also in my urethra around the kidney area. So she was like, you need to start immediately. So I was like, no, just give me some time, because I didn't mention the ozone therapy to her. And I was thinking, okay, let me explore this, proper. So I put myself on a regimen for about 3 weeks, really doing it twice a day. But when they did the scan again, it showed that the tumors had grown more.
Mm.
So I was like, okay, well, let me just do the chemo. So that made me do the chemo.
Mm-hmm.
And I think specifically, like I mentioned to you, I remember saying like, I, there's people who believe that ozone does cure cancer, but for me, cancer is a very, I do feel it's a symptom of other underlying causes, right? And it manifests as cancer. So the reason why everybody gets cancer is very different. And I feel like the reason I got it, like they tell me it's genetic disposition, but however it, I guess, formulates itself in my body, um, is not necessarily curable by ozone. But it did, I guess, strengthen the other components in my body, my immune system, so that I could have that quality of life while I was going through chemo.
Mm-hmm. So, and you said that once you started chemo, you immediately felt better, correct?
Yes, I did. I did. I
Mm-hmm.
did. Yeah.
That's interesting. That's very interesting.
Yeah, I did.
Well, maybe it's possible that the 3 weeks of just doing ozone were simply not enough, you know?
Yeah, maybe it needed to be a longer duration of time. It maybe I needed to do a different application of ozone, which was more intense. I don't know.
Mm-hmm. But okay, so you first started ozone therapy, then you added chemotherapy to it, and then did you reduce the amounts of ozone that you were doing after adding the chemo, or just the same intensity?
No, I reduced it.
Mm-hmm.
Yeah, because yeah.
So how often exactly, and what types of ozone therapy were you doing together with the chemo?
So I was doing the rectal and the sauna and the breathing.
Okay. And so how often were you doing the sauna?
So the sauna I was doing once a day,
Mm-hmm.
and the rectal once a day. So the rectal I'll do for about 20 minutes. The sauna also 20 minutes.
Mm-hmm.
And then the breathing I was doing 10 minutes.
Mm-hmm. Okay, so tell us the settings that you were using on the ozone sauna.
I don't have the Promo Life ozone machine,
Mm-hmm.
so I don't know how I would decipher that settings, but I just know that it was 1/8 on the oxygen meter,
Mm-hmm.
the oxygen concentrator. That's what it was. So my machine doesn't have any other type of settings.
Ah, okay. Which
Yeah,
machine do you have?
it's it's not a company. There's a man who I met through a friend who makes them, the generators.
Okay.
Yeah.
So it's like some off-brand home
Yeah.
made or some.
Yes. Yeah. Yeah.
I see. Okay.
Yeah.
All right.
Mm.
So you don't know exactly the ozone concentration that you were.
No, I couldn't tell you what the concentration was.
Mhm.
No,
All right.
but it was between. I'd vary for the rectal, I would do it 1/8 or 1/4 on the oxygen
Flow. Mhm.
flow, and then for the breathing, I'll turn it up to maybe 3/4 or 1.
Okay. Okay,
Mm.
sorry, I'm gonna disable my phone so it stops ringing. Um, okay, great. So you were doing the sauna every day. Now, after the sauna, would you get out of the sauna and then immediately feel like a surge of energy, or not really anything?
So my routine, the way my routine was I would breathe for 10 minutes.
Mm-hmm.
Then I would go and exercise
Mm-hmm.
for about 20 to 40 minutes, depending how I felt. Then I would get into the sauna.
Mm-hmm.
And while I was in the sauna, I would insert the catheter rectally. So it was combined together with the
Interesting. Okay, so
sauna and the rectal together. Yeah.
all right. So did you have two ozone outlets, so that one outlet was going into the sauna box and the other was going rectally, or how did you?
No, it was just it was just one outlet.
And that was going rectally.
Yes.
So, but was there any ozone coming into the sauna?
No, no, no. Just so I would sit like that for 20 minutes in the sauna and then remove the catheter and then let it flow into the ozone box after that.
Okay. All right.
Yeah.
And, okay. And after what time would you let the catheter out and let the ozone flow into the box?
20 minutes.
So
Just
for
20 minutes.
20 minutes, it was going into your rectum while you were sitting in the sauna.
Yes.
But then you were removing it out of your rectum and you were sitting for another 20 minutes in the sauna to get the ozone.
Yeah. Mm-hmm.
So it was, so you were sitting in total, you were sitting for 40 minutes in the inside the sauna, but
Inside the sauna. Yes.
for the first
Yes.
20 minutes you were only doing rectally and the other 20 minutes through the skin, basically. So it was the ozone gas was in the box, in
Correct. Yes.
the air
Yes.
of the box. Yes?
Yeah. Yeah. That's correct.
I see. All right. That's interesting. never heard I've never heard of
That's
anyone
my.
doing it this way, but you know, people always come up with new ideas. Okay, now
Mm.
right. Now if this will go like too intimate or something, let me know and I'm gonna cut it out. But I'm just trying to understand the logistics because like you were sitting in the sauna, right?
Mm-hmm.
With the catheter inserted. So how did you make sure that the catheter wasn't kinked and so that the gas flow wasn't blocked? You know what I mean?
Yes. So the sauna I have is it's very comfortable. So it's not like upright like the promo life or the longevity ones. They tend to be a bit more upright. So the one I have is a bit more laid back. It's almost like a, I don't know how to explain it, like a very comfortable couch.
Ah,
So I'm able to slouch and be quite comfortable in there, right? Yeah.
ah,
Yeah.
I see, I see, I see.
And because I'm pretty tall, I can still get my head out and be comfortable.
I
Yeah.
see.
Yeah.
Yeah, okay, now it makes sense. Interesting. Okay. So you have, this is a hard shell sauna, or is it, yes? Not
Yes,
necessarily.
hard shell. Yeah.
All right. So it's one of those that looks like a little bit like a sci-fi kind of pod. Yes?
Exactly. Yes,
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 yes.
yes, yes,
Yeah, I
yes.
think I know what you mean.
Yeah.
All right, great. Okay, so you're doing this every day. Okay, another question. So were you doing the sauna before the chemo or after, or how were you handling this?
Well, one of the things about when I had chemo was my veins were really bad. So it
Mm-hmm.
was always a struggle to get a vein to put the IV in. And they wanted to put a port in, but I was very, very adamant that I'm not having a port. So I made sure that every time before I go there, I exercise, I do the breathing, I do the whole protocol so that my veins are as puffed and plump as possible. That was like my goal. So every time before, so it was always the day of, like before I got there, I would have done this whole procedure, the protocol, and then usually I would wait a day or two until for after.
Mm-hmm.
But the first time I had my chemo, I went immediately after to go and do the ozone,
Mm-hmm.
and I felt great. And then I thought, because there's so much mixed information and sentiments about doing ozone and around cancer and chemo. So I thought, okay, well, the next session, maybe I'll wait and see if I feel any different.
Mm-hmm.
So I did wait a day. And to be honest, I felt more nausea. I think the nausea was more because I still did feel nausea, but not as much as the first time.
Mm-hmm.
So I did feel that I just felt like the nausea, the side effects are not more until I started doing the ozone protocol.
Mm-hmm.
Yeah.
And then the nausea went away.
The nausea, it wasn't as intense
Mm-hmm. But it was
when I did the
markedly,
ozone.
but it was markedly diminished after you started the ozone.
Yeah, it was I could tolerate. I didn't have to take medication or, yeah, I could handle it.
Mm-hmm.
Yeah.
So the ozone, so it's greatly reduced some of the side effects of the chemotherapy, like for example, the fatigue. It basically nearly completely eliminated it. Would it be correct to say?
Yeah. And you know, like one of the things about chemo, they give you steroids, right?
Mm-hmm.
So that you don't get a reaction to it. Like my energy was just incredible because of the steroids, right? And obviously the ozone, I think what is it? It enhances whatever's happening in your body.
Mm-hmm.
So I would have like remarkable energy. And I know a lot of people who are on chemo, like they'll feel that energy for maybe 2 or 3 days
Mm-hmm.
after. But like I felt like that all the time.
Mm-hmm. But
Yeah.
did you also receive steroids the first time around in 2018?
Yes, I did. I
Mm-hmm.
did.
And it didn't do anything for you?
No, not really. Maybe like a day I might feel a bit, okay, a bit, but
Mm-hmm.
nah, not, yeah.
How often did you get chemo per week? Was it once or twice a week?
It was every 3 weeks.
Once every 3 weeks?
Yes.
Mm-hmm. Okay, yeah, very interesting. Okay, so some things like the fatigue was nearly completely eliminated, but you still did experience hair loss and you still did experience some nausea.
Mm-hmm.
Was there anything else that you felt that the ozone therapy improved?
Um, well, like my skin, like usually, obviously, like you can imagine, also just being in the sauna combined with the ozone. Like before, my skin was just like dry, cracking, flaking, painful sometimes. I didn't have that problem at all.
You see,
At all.
this is very interesting. You see, because some people they fear that the ozone may somehow like make the skin drier, and just yeah, that they will lose moisture because of the ozone. But you experience exactly the opposite. Yes.
No, yes, exactly. Yeah.
Very
Like
interesting.
my skin was people would always compliment. Like there's one thing that people always complimented me on was my
Mhm.
skin.
All
Yeah.
right. And so, how long was this going on? So, how long was the chemo series for? How long did you have to do it?
So it was from the beginning of June to the end of September.
Mm-hmm.
And it was, yeah.
Mm-hmm. All right. So June, July, August, September. So 4 months. 4 months of.
Yes.
Wow. Yeah. This is for some people. I mean, okay, for most people, chemo is extremely daunting. It was like just what you experienced in 2018, right? It's like
Yeah. Mm.
absolutely just crushes you. Like people cannot function, right? There's complete fatigue. They feel depressed. They lose hair, nausea all the time. It's like my mom was going through this, and it's just devastating, right? So you basically have the cancer diagnosis, and you have the devastating side effects of chemotherapy on top. But for you, it was a completely different experience. You not only started feeling better right after they started the chemo, but you could function. You didn't have fatigue. You had energy the whole time, right?
And one other thing I want to add was I was taking supplements, like vitamin supplements, both times, and they both did make a difference in terms of making me feel better. Like the first time, I did have fatigue, but the supplements did make me feel better. This time with the ozone, I didn't. I really honestly felt like I didn't have chemo brain.
Mm-hmm.
Like I felt like the supplements were actually doing what they were supposed to be doing.
Mm-hmm. Okay,
Yeah.
what is the chemo brain? Chemo brain. Explain this, please.
So like the first time, I remember feeling like I couldn't think. Like I couldn't. Like I would forget words. I would forget. It almost felt like, I guess, what you call dementia.
Mm-hmm.
Like it was just very like a struggle mentally with everything. Like coming up with answering questions, having conversations. It was just an effort mentally.
Mm-hmm.
Like even writing was a mental effort. Whereas this time around, I did not have that experience
Awesome.
with yeah.
Great. Mm-hmm.
And I do believe it was because, not only the ozone, but I was also taking vitamin supplements as well. But
Okay.
this time they were actually working like properly.
Mm-hmm.
Yeah.
So let's hear it. What supplements, what vitamins were you taking?
So one of the main things was like the different, I need to learn I need to be better at medical and scientific names, but there are different forms of magnesium, like a lot of cognitive supplements that support the brain. So the omega-3s, the magnesium, vitamin C, of course, mushrooms. There's different variations of mushrooms I was taking. And they all have their different scientific names that I would have to go out and get them and read them to you. But that, like, I know there was 2 forms of magnesium I'm still taking now. Lipic acid was one of them.
Mm-hmm.
But yeah, and then glutamine.
Mm-hmm.
Glutamine, yeah, and glutathione as well.
Glutathione as well. Okay.
Glutathione and glutamine. So I took those same ones as I took in the first time with chemo, and I'm taking them now. And this time I'm like, oh, they're actually, one of the ozone is enhancing the effect of what they're supposed to do.
Mm-hmm.
Yeah.
So are you taking them spaced apart from ozone or right after the ozone?
I usually take them in the morning.
Mm-hmm.
And with so I'll take them. Yeah, I'll take them before I take them all before I go and do my routine.
Mm-hmm.
Yeah.
You take the glutathione orally or through a mist or IV? So how do you take them?
I took it as a tablet. Yeah, orally.
Uh-huh.
Yeah.
All right. Okay, there was one thing that I wanted to ask you, but now it's now I have a case of I hope temporary dementia. I guess. Yeah. Okay. So so after the series of chemotherapy that ended, so you got retested and you got some really good news, right?
Yes. So according to my oncologist, there's been no evidence of the tumors have all diminished. There's no tumors.
Yes.
The only thing, which I'm very excited about, the only thing in terms of like immediately after my whole finishing the chemo and then doing my blood test, the only thing which was outstanding was my T cells were low.
Mm-hmm.
And I know for a fact that was because I was overdoing it. I was really like, I've got this energy. And I think, when you have cancer and having it the second time going through it, it's like you really do feel like you need to live your life to the fullest, because it's like, okay, I need to get everything done and do everything. So I know I was overdoing it that last month of my chemo. So my T cells were very low. But they've gone up. So I feel, so now they're back to normal. But that was the only thing which was not exciting, but yeah.
So basically, so all the cancers have disappeared. The liver, urethra, everything. Awesome.
Everything, yeah, everything is gone. Yeah.
So are you do you keep doing the ozone treatments or have you stopped?
I still do them, but I don't do them as frequently because now, like, I'm back to my normal life and routine. I don't necessarily have that chunk of time to do that same length of protocol. So I might, like, one day I might breathe, one day I might just do the sauna and, just 20 minutes in the sauna. Yeah, so I don't do the whole all of the steps. Yeah, in one day. Yeah, I'll do bits and pieces.
But you're still doing at least one form of ozone treatment per day, yes?
Yes.
Interesting. Okay, awesome. Is there anything else you'd like to add? Something that I forgot to ask?
I can't think of anything else.
Yeah, I mean, this is pretty encouraging and very inspirational, right?
Yeah.
I hope that more people will try it.
I really do hope so, because the quality, your life, when you have cancer, you feel like, okay, this is it, right?
Yeah.
But you want to enjoy the this is it moment as much as possible. And I think for me, ozone has made that possible.
Mm-hmm.
Yeah.
Awesome. And it also, also shows that home ozone treatments can be very effective, right?
Yes.
It had nothing to do with needles, intravenous administration. No, you were just doing your ozone spaceship.
Yes.
The ozone spaceship, right?
Yes. Yeah. I'm curious though, because a lot of people have said, because I was looking to do that IV ozone, right? And in the town I live, there's nothing like that. So that's when I started exploring the rectal application. And I'm just curious because people say it's the rectal and the IV application are the same. Is that true, or
I'm
we
sorry.
don't know?
No, yeah, no, I I don't believe this. No, no, this is, in my opinion, this is one of those urban myths. No,
Okay.
I believe rectal applications can be quite effective depending what you're treating. But no, I don't believe that they're anywhere close to the intravenous treatment. Although, you know, when you talk about intravenous ozone treatments, there's also like a different selection, right? So you have the
Okay.
10 pass, and then you have the major chemotherapy. And so there's a huge variation within the intravenous treatments. Um, but yeah, no, I think, my opinion, uh, the ozone sauna, or the ozone spaceship in your case, could probably come closer to the effect of intravenous ozone than rectal insufflations.
Oh, okay. Wow.
Mhm. Yeah, but this is really great, because, you know, there's an ongoing discussion. You know, some people say that, oh, the ozone saunas, you know, you cannot absorb ozone through the skin. This is there's no research that shows that proves that. This is nonsense. But yeah, I personally have experienced like incredible results from ozone saunas, and in my opinion, they're one of the most effective, most powerful treatments that there are.
Mm.
So yeah, this your story completely busts this myth that you have to go to the doctor and you have to do it intravenously, otherwise it's for nothing, right?
Mm. Mm. Yeah.
No, it's not true, and you're a great example for that. Um, well, so thank you very much. Oh, I want to add, I need to add, this is not medical advice. So please, if you're sick, go to a doctor. Don't listen to a crazy woman on the internet. You know, just a disclaimer to keep away our government overlords. All right. Well, thank you again. And thank you for agreeing to this interview.
Thank you.